I want to show you my black lilies. Come with me this way.
It was great to see her out in the garden and moving around. And
aren't they gorgeous? Let me move the pirate ship. It's our cat's pirate ship.
she never stopped. She kept moving.
Squash, bell peppers, tomatoes, of course.
The story starts for me long before the diagnosis of cancer.
I am Debbie. It is not Deborah. That's the name my mother called me if I was in trouble as a kid.
Larry Henneke, what do I do? Please my wife. So I've been married 54 years, it'll be 55 in June. I could see that her abilities to eat and mobility and things changed long before we actually knew that she had cancer.
It was really painful when I was in the process of being diagnosed because I had hurt for quite a few months and it was getting more intense. Dr. Tabuyo, the one who verbalized the diagnosis, ovarian cancer advanced. When I said I didn't want to do chemotherapy, he said, well, I really would like for you to, because you're only looking at 2.5 to 3 months. She said that they were going to do the genetic counseling. It was really easy, which it was.
When you're diagnosed with cancer, it might be driven by something in your gene. Patients who have BRCA gene have issues with something called DNA repair, meaning our body is constantly trying to maintain or repair our DNA, right? And that's where chemotherapy is head to. And if you're already struggling to repair your DNA in those cancer cells because of the gene, there are certain chemotherapies that will hit those cancer cells more than rest of the body. We almost always see responses in patients with BRCA-associated tumor with certain kinds of chemotherapy.
I did have the gene.
So normal CA-125 numbers are 0 to 35. When we went and talked to Dr. Tabuyo, her numbers were 4,000.
I had chemotherapy, then I had surgery, then I had chemotherapy again. And after being off chemotherapy for a while, I finally started having some energy.
I think after the second chemo treatment, that number went from 4,000 down to 50. And the doctors themselves were kind of like amazed at the drastic change that had happened.
Bree is my nurse that I love, who did my first infusion and many after that. And I can honestly say that the people who work at the Dignity Healthcare, I consider them my friends. The people who have been placed in our path are very much angels on earth. Okay, well, it's early spring and we haven't decided exactly what's going in them, but probably the new containers are probably all going to have squash plants, or we grew one pumpkin plant and it had one little pumpkin, but it was perfect.